Hello and welcome to this little video on a drug known as Methotrexate, which is called an antimetabolite. It works by inhibiting enzyme dihydrofolate reductase. Some of its uses include severe psoriasis, rheumatoid arthritis, Crohn's disease, as well as various cancers. It's given as a once-a-week dose. Folic acid 5 mg is also usually prescribed alongside methotrexate, taken on a different day to the methotrexate dose. It's really important that it's taken on a different day to the methotrexate dose because methotrexate is a folate antagonist, and taking it at the same time can actually decrease methotrexate efficacy, which means that it won't work as well. Methotrexate has various monitoring that a patient must undergo, including a full blood count and renal liver function tests every 1 to 2 weeks until it is stable, then every 2 to 3 months of monitoring after that. Patients should report all signs and symptoms of infection, especially a sore throat. Patients must be counselled on various things whilst taking methotrexate. They must be counselled on the signs and symptoms of blood disorders, liver toxicity, and respiratory effects. They must also be advised to avoid UV light exposure, including sunlight. This is due to the photosensitivity that methotrexate can cause. They should also be advised to avoid OTC aspirin or ibuprofen. They should also be counselled on a dose, which is once a week dosing. They should also be counselled on the patient alert card and be advised to write the day of the week for dosing on the patient alert card so that they don't forget. Folinic acid is a drug which can be given in methotrexate toxicity. This is given as calcium folinate. It's important to highlight that this is not the same as folic acid. Here are some of the important interactions that can occur with methotrexate. So as you can see from the first example, it includes NSAIDs, and this is why it's important to advise the patient to avoid OTC aspirin or ibuprofen, because NSAIDs can increase toxicity risk when given with methotrexate, and as well as nephrotoxicity risk. There are also other important interactions on this slide which is important to learn, especially for the pre-reg exam. In terms of dispensing and supplying methotrexate, the dose and frequency should be written clearly on the label. One strength of tablet should be prescribed and dispensed. This is usually the 2.5 mg tablet. The day of the week for dosing should be written on the outer packaging of the methotrexate box to avoid overdose. So that's it for this video. Please like, share and subscribe if you want more videos like this on other drugs.